on patient education. Today we're going to be discussing some of the procedures that can be done in the office relatively simply to help with facial rejuvenation. And if you could focus the camera on our patient today, who has kindly agreed to serve as a model. Now come closer to the point where you can see what's bothering her. Are you in focus enough to see the forehead wrinkles as a marker?
Yes.
Okay. So Andrea is a relatively young patient who's showing the earliest signs of facial aging. The good thing is I don't think you've ever tried anything on the face, right?
No.
So it's rare these days to find somebody that's kind of not started doing things a little bit early on. So one of the things we see is transverse lines on the forehead, and we're going to treat these with wrinkle relaxers. The wrinkle relaxers can be either Botox, Xeomin, or Dysport. We see also a pronounced glabellar line, more on one side than the other. So she has 11s, but one side is more than the other, and we'll treat that again with wrinkle relaxers. And then going on to the smile lines, we'll use a little bit of those products as well. The next area we're going to focus on is the nasolabial folds. She has starting to show some nasolabial folds here, and those we will fill with a product called the Radies that's going to be injected and will stay about a year and a half at a time. And then we're finally going to finish up the treatment with a laser treatment. The laser treatment is designed to kind of resurface the whole skin, help with the pore sizes, and help with the very fine lines that are not going to be treated with those first two most focused of a wrinkle relaxer in the smile lines. Go ahead and smile to show the formation. You can see her muscle here is a little hypertrophic, and you can relax now. And this is the most superficial of the injections. I'm just going to put in a little bit of the product, which should be enough to weaken those muscles. Okay, hold pressure here. And I always inject with an assistant. Today it's Ayana. You can focus on Ayana for a second. And it's really a two-person job to be able to inject properly, because as soon as I finish injecting an area, I want to put a little bit of pressure there to prevent any swelling that we don't need. So I'm treating the forehead lines for a series of injections. And that's probably the most painful part to inject for the patient. Doing okay, Andrea?
Yeah.
I'm just going to deposit the drug that will act by paralyzing the muscle. And the nice thing about those medications is you can inject them exactly where, based on the lines, I feel that the muscles are strongest. The drug will take 3 to 4 days to work. As the drug works and the muscles don't move anymore, the skin will repair itself, and those lines will, don't like to use the word disappear, but improve dramatically to the point where there won't be a cosmetic issue anymore, hopefully. And you can let go of the eyes now and move towards. Okay, and hold pressure this side, please. Finally, we're going to treat this wrinkle with the wrinkle relaxing drug. And go ahead and frown for me. Frown. Good. All right, and that shows where the muscle is starting and ending. Relax. We'll start here. And this is actually the muscle that requires the most number of units to paralyze it. It's also right close to the nerves that innervate the whole forehead, so it is a little bit sensitive. When doing wrinkle relaxers such as Botox, Dysport, or Xeomin, most patients will have to come back and do it on average every 4 to 5 months. When first starting, every 3 months is a good idea, so that the lines don't come back immediately. But patients that have been with us for a little while, we can space out the treatments because the muscles do get weak and the lines don't come back as quickly. That's probably the biggest drawback of this treatment, is the fact that it has to be repeated. Unfortunately, at this point, there's not a great permanent alternative. Next, we're going to move on to the fillers. Now, unlike the wrinkle relaxers, the fillers are not medications, but substances that are designed to stay in the body with the body accepting them. So, the wrinkle relaxers will come, relax the muscles, and go away for 3 months. The fillers are designed to stay, really as long as possible. And the two products that are most popular are Radiesse, which is a calcium-based product, and that will last about 12 months, and that's good for deeper lines. So we're going to fill in those deeper lines with the Radiesse product. Okay? Ready? The initial needle hurts a little bit, and then there's numbing medication in the product that's we mixed in, so it won't hurt too much once we get going. I think overall people actually say that fillers hurt less than Botox, but you'll tell us at the end. I made you smile, but don't smile. Alright, we're going to have to interrupt for too much smiling. Continuing the injection, and it's just threading the needle and depositing while withdrawing a little bit of the product at a time. You don't want to inject fast. That's how you get a lump of the product that she will feel and won't look very good. So kind of go in fast, but inject while withdrawing slowly. Okay, now we're going to start in a similar fashion, injecting this side. A little stick at the beginning is felt by the patient. And then once we're underneath the skin, I'll feel it less. We're going to go all the way to the root of the nose and fill in that line. I'm using 1 tube of Radiesse. That's about 1.5 cc's of Radiesse. Usually we'll use anywhere between 1 to 2 tubes. 1 tube on younger patients, such as Andrea, and maybe 2 tubes if the lines get more advanced. Usually if I'm just treating with wrinkle relaxers, I won't use any fillers in those lines because the wrinkle relaxers will take care of most of the problem. But since we're doing both, I will use just a little tiny bit of the filler. It's not worth opening a whole tube and charging the patient for a whole tube for the amounts used, but in combination cases it's useful. And we're going to go ahead and use a filler in addition to the wrinkle relaxer that we already injected to help her get a head start on fixing this line, because this line is pretty deep and waiting for the Botox or the Xeomin or the Dysport to take care of it will take a few treatments. Okay. Little stick. And again, just takes a little bit of the product. And in addition to the product, just passing the needle itself. So some providers of Botox or Dysport, including myself, if I'm not opening a whole filler tube, I may still choose to pass the needle to free up that deep skin wrinkle, because the wrinkles take years to form, and a needle can help accelerate the body freeing it up. And you can actually feel when you're passing the needle underneath a deep wrinkle like that, you can feel the attachments. Now, a needle has a cutting point, at least this one does. Some of them are blunt, and you can feel the needle detach those cutting points, those attachments. This next step of the treatment, we're moving on to a hyaluronic acid. Hyaluronic acid is a clear filler. In this case, I'm using Biltero, which is made by the same company that makes Radiesse, but I also love doing Restylane and Juvederm. They're both excellent products as well. Hyaluronic acid we're going to use for finer lines. So, just we'll catch a little bit of the fine lines that we haven't treated with the deeper filler. I'll also use it for the corners of the mouth to try to raise up the corners of the lips, which is a sign of the aging. So she doesn't have much need for it, so we're just going to use maybe half a tube to evert the lips. And here we're just injecting the corners of the mouth. Like I said, she just needs a drop or two. So. A little bit on this side. Alright, so we're finally going to finish up with a resurfacing treatment. Resurfacing treatments are going to be treatments that stimulate the skin to remodel. Chemical peels, we use the VI peel, that's a popular treatment. For more advanced cases and with a little bit longer recovery, I'll actually use a laser, and we use a fractionated CO2 laser. A fractionated CO2 laser will send laser beams. Can you see the little dots here? By coming close?
Yes.
You see? So the dots are where the laser has struck the patient's skin. That drills micro holes into the skin, leaving the non-dotted areas are normal areas of skin, which will help accelerate the healing. So you're basically sending a message to the body's healing mechanisms to come into this area and heal those laser burns. And that healing process will result in collagen deposition and skin tightening. And that's how the laser gets its rejuvenating effects. So we're just going to keep going and shoot the laser at all the face.